Which session or topic do you like the most and why?
First of all, I would like to say it's always nice to be coming to Taipei again because I was trained here 15 years ago. Yeah. So thanks to Professor Chan for this opportunity. And if you are asking which session I like most, I think all the sessions are interesting. I always like to learn about mapping and ablation of ventricular tachycardia.
I like most of the topics and I like the session overall very much. It's a very comprehensive session. Always, APHRS has done a very good job. Specifically, I was focusing more attention on sudden cardiac related topics as well as arrhythmogenic syndromes like Brugada syndrome. I was there for a few sessions yesterday as well, which were very, very good. I'm sure we can get a lot of information from these that we can utilize for day-to-day practice back in Sri Lanka.
During this conference, which part impressed you the most?
Today morning I have had attended the faculty meeting, and the Japanese doctors are starting the new registry in the whole Asia, Brugada syndrome patient. So I thought that this is a very important for us, for Mongolians, because we never have had estimated our Brugada syndrome patient, and we don't know how many patients we have of the Brugada syndrome. So I have had applied our country to this registry, and it will give us the opportunity to reduce our sudden cardiac death, or it will give us an opportunity to improve our service, electrophysiology service.
The opening ceremony is very impressive. There was a very good performance, percussion, and also it's quite shocking because it's opened by the president of Taiwan.
Would you please share any new knowledge or new technologies you learned from this conference?
Quality of life, AF patient quality of life station, and they showed a very important a point of view, because every AF patient, have I said, it's like a symptomatic patient most likely to benefit from this treatment. But how about for the asymptomatic patient? The main problem for the doctors like me, or who is just starting new electrophysiologist, the asymptomatic patient, there is a much more difficult. There is no any suggestions what to do with symptomatic patient. So in this session, I have had get familiar how to do with the asymptomatic patient and how is the quality of life. So I think that this session was very important in my opinion.
A lot of things I learned in this conference, but yesterday I went to one of the innovation booth, and it is teach us about the new mapping system, which is very useful to map the complex atrial arrhythmia. I think this advancement in technology will be very useful in the future.
Yeah, of course, I'm quite hopeful, and we were focusing on a lot of time on device implantation. Back in Sri Lanka, we do large number of device implantations of various types of devices, bradypacing as well as heart failure devices. And we attended few sessions related to CRT implantation and optimization. Myself as well as two of my other colleagues, Dr. Suresh Kottagoda and Dr. Manole Kamwatage, and we have thoroughly enjoyed these sessions and gathered a lot of information.